Hello and welcome to the Ilene Silverman Show. I'm your host Ilene, and on this week's program, our guests from Community Hospice and Palliative Care discuss National Healthcare Decisions Day and the importance of advanced care planning for you and your family. Stay with us. We'll be right back. Welcome back. Thanks for joining us for our show. I'm delighted to introduce my guest, Billie Adkins, Regional Director, Community Hospice and Palliative Care. And Billie, it's wonderful to have you join us.
Oh, thank you for having me today.
Well, it is a pleasure, and I've been traveling past your offices on Northwest 43rd Street for quite some time now, and now I'll finally get to learn, and have been learning, about community hospice and palliative care and all the wonderful things that you are doing in this community. And it's wonderful to know about all these important parts of our community because it makes us stronger, enriches us.
Absolutely.
So thank you. Give us a little overview about
Sure.
the organization.
Community Hospice has been around for going on over 42 years. Nonprofit, mission-driven, started by a pastor and a parishioner who didn't want to die in the hospital. And such a beautiful thing, and it has grown to now over 1,300 patients a day and over 200
Wow.
children with life-limiting or chronic terminal illnesses.
Right.
Dedicated, and I think just the name community in itself is focused on service. It's all of our employees have servant hearts. We're very particular, and it's not just providing hospice and palliative care. We also invest in the communities that we're in. We hire from those communities and provide education within the communities and really see the needs of the community and listen to the community. Recently, we were able to honor two gentlemen in the community that are legends.
Right. Rodney Long, Charles Chestnut.
Absolutely.
Well-deserved.
Well-deserved. I was humbled to be in their presence and hear their legacy. So we developed the Legacy Award, which we'll be doing annually. We want to promote good in the world and servant's heart and people that are serving their communities, and what a better way to showcase.
Oh, and you
and
picked
partner.
two such outstanding gentlemen that I personally have known for years, and it was so well attended on Zoom.
Yes.
All safety
Yes.
protocol.
Yes, absolutely.
But it has set the standard for next year, certainly.
It sure has.
And thinking about setting the standard. Coming up April 16th, okay, you pay your taxes on April 15th, then on the 16th, a very important day once again.
Absolutely. Well, there are two things we all do in this world. We hope is pay taxes and eventually we all die. And I think it's important for families to start having these conversations, especially in the year that we've just had. So on those dates, we are offering virtual sessions online, and we want to open that conversation for families and help walk them through how to do a living will, how to designate a health surrogate.
So that day, National Healthcare Decisions Day,
Yes.
kind of does bring it all together for making those important decisions, which which are difficult decisions, as you said. We know those are all parts, leaving this earth is part of being here, but acknowledging all the different facets of what that entails can be a difficult conversation. And so April 16th is a way to start the conversation going.
Absolutely. And in the absence of those conversations, we can create more heartache for our family by avoiding tough conversations. So we really want to facilitate families having those discussions, walking them through that process, being a resource, and getting people's paperwork in order not a will, but a living
Right.
will about their health care wishes is so important. We've seen a lot of death in the past year with
Certainly.
COVID, and these documents are so important in the absence of family at the bedside readily or available at all. And it's important that people have their wishes known.
Yes, and it takes the additional stress off the family member who then has to make that decision, or members not knowing forever if they've done the right
Yes.
thing
You
for their
know-
loved one. That's a burden that people should not have to bear on top of everything else.
It's very true. I had a mother say, "My children will know what to do," and I've had children say, "I don't know what to do, and I don't want to make a decision." It's a gift that we give our loved ones.
To
My children won't ever wonder if they made the right decision because I've already
Because
told
you-
them what to do.
you have already
They're
taken
going to
care of
honor
it.
what I've told them to do. And
Yes.
it's not theirs to own, and it will affect how people grieve if in the
Certainly.
absence of that paperwork.
And Billie, we're going to take a quick break, and then we're going to come back and talk more about all of those opportunities.
Great.
Stay with us. We'll be right back. We're back talking about National Healthcare Decisions Day. And Billie, it's coming up on April 16th. And I know you have collaborated with others in this community, many partners. Who was involved?
We're very lucky here in Gainesville. You have a robust collaborative group involving the hospitals, UF, North Florida Regional, the VA, all of the hospices in the area have all come together to work to promote people having this conversation and getting their healthcare surrogacy and their living will completed. It's so impressive that everything goes to the wayside, and it's a joint effort to make this possible.
Yes, I like that. The community definitely benefits when everyone works together.
Mm-hmm.
And this is all about advanced care planning, advanced directives. I can tell you that I've heard these conversations before, and I don't think my family and I have filled out, I know, I've already confessed to you, filled out a form yet. So one more time, I am listening to the importance of this as you explained to me and others. First, about Honoring Choices Florida.
Absolutely. Honoring Choices Florida is a document from community hospice and palliative care that we can go through with families either virtually or by phone or in person. We do private sessions at no charge to help people get this document complete and facilitate that conversation. I think it's so important that, anyone over the age of 18, this is not a document that the aging need to do. We all need to have one, especially in the age of COVID.
Yes.
And unexpected losses, along with, I had a car accident a couple years ago, and it could have been really bad, but I remember sitting in the car knowing my kids will know what to do.
If
And
they have to.
it
right.
gave me peace. I think we avoid the conversations because it's not comfortable.
Exactly.
And we really,
we want to say, oh no, I don't want to deal with this, but
absolutely.
when you have to deal with it, and there's so many good questions and ways that you have set this up, that when people don't know these answers, it would be extremely difficult. And some of these, if you don't do it when you have the option, there's no going back.
There isn't. And I've been a hospice nurse for many, many years, and I have witnessed prolonged ICU stays or ethical dilemmas and legal situations that could have been avoided with a simple conversation. And it does affect how people grieve later if they had more information from their loved one. So it's so important. That's why we have it. You can complete electronically.
Right.
You can print it out from the website, or we will mail you one. There are many ways, and you don't have to particularly use the Honoring Choices document. There are many free
Rather-
living wills available online. Healthcare Decision Day is more about, no matter what document you use, it's time.
It's saying
And
do it.
It is, and if you want to change it later, you can, but it's so important. So let's say if I have an estranged family member or a spouse that I
Right.
didn't legally divorce, or if I have 10 kids, they all need to agree in a majority. I can't get 2 kids to agree. So there are a lot of dynamics that could create a situation to cause me more suffering while they try to figure that
Right.
out. And in a selfish way, I've done this long enough that, I want to make sure they get it right.
Yes.
Because I want to be at home and comfortable with my grandson. So
And you know the difference it can make.
I do.
And I see that in the back of your honoring choices of this advanced care initiative, there is a place you can cut it out and put this in your wallet so people know, should something happen, as we say, God forbid, how to find this. You store it with your the person you've designated as your surrogate, with your doctors,
And
with
that's
hospitals,
important.
just to even figure that out.
People tend to take this document and file it away with their important
Right.
papers in a lockbox where nobody can
And
get
then
to
no
it.
one says, well, we think
Yes.
they filled it out, but we don't know.
Yeah, so I typically...
I mean, we're laughing, but we know it's not funny
it's-
when the crisis is
That's
there.
true. I tell patients and families, fold it up, give a copy to your physician, your health surrogate, and then fold it up in a Ziploc bag next to the ice cream because that's just a weird place for it to be. And your family's always going to go get the ice cream.
Yeah,
So
and they're going to remember.
Yes,
Yes,
yes, absolutely.
I'm going to remember that.
Yes.
Billie, so much good information you have shared. We are going to take another quick break. Stay with us. We'll be right back. We're discussing community hospice and palliative care, and I'm pleased to introduce Dr. Stefanie Lord, Senior Medical Director. And Stefanie, very pleased to have you join us.
Thank you so much for having me.
We're learning so much about community hospice and palliative care and all that you're doing in this community and the importance of this knowledge. And help us understand, what is the difference between hospice care and palliative care?
Well, that's a really good question. So, palliative care is available for anyone with a serious illness, regardless of their prognosis. And palliative care in our organization can be accessed by either a referral from a physician or by a self-referral. And you can talk to your physician about it, but it's available for people who, like I said, with a serious illness,
Right.
who need help with either symptom management or advanced care planning, like we talked about the honoring choices earlier. We can help with difficult decisions that come along during the course of a serious illness. So we have palliative care that sees patients in the hospital. We have palliative care that can see people who live in nursing facilities.
Okay.
And we have palliative care that can come out to patients' homes.
In your home, right.
So we have a whole team, primarily nurse practitioners with physician backup, that'll come pay visits to the home and help patients through these difficult decisions and serious illnesses.
Right. And do you find that patients don't really reach out early enough, that they could
Absolutely.
be more comfortable
Absolutely.
if they were receiving
You can
palliative
receive
care?
palliative care right along with curative or aggressive care. Even, palliative care can go right along with chemotherapy during a
Okay.
cancer treatment or any other kind of serious illness treatment. It doesn't preclude any particular types of treatment. It just goes right along with it.
Okay.
Um,
And certainly, and all of this is offered to the community free of charge in one way, or through Medicare, Medicaid, different ways that things are handled, but everyone should know they can reach out for this assistance.
Right. Now, so palliative care is paid for by Medicare, Medicaid, and most private insurances.
Right.
Just like any other medical services.
Yes.
Then we also have hospice, which is a separate
Yes, entity.
right,
Okay.
a separate entity essentially, where if the serious illness progresses to the point where it's considered a terminal illness with a life expectancy of a year or less,
Right.
Medicare actually says 6 months or less, then you are eligible to receive hospice services.
Okay.
And those are that's actually a much more comprehensive program, which involves physicians, nurse practitioners, nurses, chaplains, social workers. We have a whole interdisciplinary team.
All trained to give hospice care.
Exactly. All trained in palliative and hospice care.
Right.
And this is completely free of charge to the patient. It's covered by Medicare, again, Medicaid, and most insurances.
Right.
We don't charge any kind of copay. And those services can also be received anywhere a person is living, whether they're at home, in a hospital, in a nursing facility, and so forth.
Oh, that's a whole lot to know. And okay, can you access this yourself if you're the patient?
You can actually. So you
Okay.
can be referred again either by your physician or you
Right.
can self-refer. Your family can refer. We have a referral line, an 800 number that anybody can access. If you're referring yourself, then one of our physicians goes back and communicates either with your physician or gets some medical records to, verify that you're
Right, to
qualified
get-
for hospice. But you can self-refer, absolutely, and we'll
Okay.
send someone out to give you information and talk with you more about our programs.
And again, if you filled out one of those advanced care planning, the whole thing would be just give you more peace, everybody involved, more peace of mind.
Exactly.
But now you've been dealing all these months with COVID, and certainly that has caused a lot of differences.
Absolutely. I mean, unfortunately, we have a lot more patients because of COVID.
Right.
And it's been, more difficult to take care of people because of the restrictions. But our staff has continued to go to patients' homes, to see them in hospitals, to see them in nursing homes with a lot of protective equipment. And we've also done a lot of telehealth during this time frame.
Oh, yes. Now, do you? It seems like telemedicine, telehealth is going to stay.
Yes, it is. I mean,
It's-
now that we know how to do
Now
it.
that we've turned the corner.
Exactly.
Okay.
I mean, it's going to stay. It's not going to stay to the extent probably that we're using it right now.
Right.
But
still.
it'll be ongoing, and it's particularly useful for people who live in rural areas and
Yes, they
maybe
don't have
trans-
access.
Exactly, or have transportation difficulties. So telehealth will definitely continue after this pandemic is over.
Well, Stefanie, you and Community Hospice and Palliative Care are doing so much for this community. I really thank you, congratulate you in your leadership role, and I know you have a whole group, you've already spoken, of wonderful people behind you to make this possible
Absolutely.
for our community. We certainly are benefiting from having you right here on Northwest 43rd Avenue with all the good people to give us good health care.
Well, thank you so much for having us.
My pleasure. Thank you. And stay with us. We'll be right back. We're talking about community hospice and palliative care with Regional Director Billie Adkins. And Billie, thanks for coming back and for sharing these wonderful cats that we each have on our laps. Dr. Stefanie Lord has told us so many wonderful things about your organization, and this is one more. These cats.
We all miss hugs and touching and comfort, and we know that our seniors are isolated. So in partnership with Elder Options, they had a grant for these robotic animals, cats and dogs, and we asked for a supply of them. We have 50 cats, and we're hoping to receive 50 dogs. They're
Right.
animated, they move, they feel like real animals, and that's so important. It's more than just providing hospice care, but really caring for people and the emotional, the physical, it all goes together, the spiritual needs of the individual and the family. So these are just a tool to help people be comforted in this time, and we're glad to do it. And a lot of projects like this, like our veterans services, our
Right.
pinning ceremonies, we provide care for the unfunded, regardless of anyone's ability to pay. You're able to access hospice and palliative care. It's the right thing to do to serve the
It is.
community.
It
And
is. No one's ever turned away.
No, never. And especially, the children that we take care of, it's such an important, they're still receiving congruent care, which means they're getting really expensive therapies while they're
Right.
receiving the support of our services. So we count on philanthropic donations within
Yes.
the community to continue our mission and to go beyond just providing simple hospice care, but
But
really
to reach all in the many ways that you were doing. So how, as part of the community, can we help? Certainly with donations.
Absolutely. Donations.
Through your website?
Through the website, www.communityhospice.com. They can come by the office. We've had people drop off prayer blankets, monetary donations.
Right.
Just the simplest things, and
people
really
need.
big things. Yes.
Yes.
And so even in this strange time,
Masks. I mean, you
people
need
still have
so many
loving
things.
hearts, and there's so much good that has come out of this community, and we're just so thankful. So
I believe so, and I love to hear that because I have such a heart for the community, just like you and so many actually of our viewers, this audience, and you're just exemplifying that aspect of this community and how it enriches all of us. And once again, I want to talk about April 16th, National Healthcare Decisions Day. It's an important day, a starting point to consider advanced care planning. And you've been telling us that, and Stefanie, how important that is.
absolutely, and that is something that we don't get paid to do. We have, it's a community mission, and so donations also help support those kind of services from community hospice and palliative care, because we believe so much that these are important conversations, and we want to prevent any suffering or any struggle, whether it's
Right.
with decisions at the end of life when it is time. Because again, we all will pay taxes, and we all will leave this world
We'll
one day.
all leave the earth, yes,
Yes.
so we know. So I thank you for so much important information and sharing this with us. I truly appreciate it.
It's been
Many
a
thanks,
privilege.
and for letting me cuddle the cat, because it is very comforting, and it just feels so real. I know how many people will be benefiting from having this pet in their home and in their heart. And thank you, and Dr. Stefanie Lord again.
Absolutely.
And I'm so glad that you tuned in. I hope you will remember April 16th, National Healthcare Decisions Day, and start the conversation with your family, with your loved ones. It will make a difference. So glad you tuned in, and hope you join us next week.